Welcome back to Midday. We're joined by Dr. Rishiraj, and we're talking about all your oral health as we usually do with our oral and maxillofacial surgeon. Thanks for being here, Dr. Rishiraj.
You're welcome. Thank you for having me.
Today's topic is cleft palates, right?
Cleft lip and palate.
Yes, cleft lip and palate. This is something, are we still seeing prevalence of this? Is this really something that you see quite a lot still?
Yeah, I mean, the average in the regular general population is about 1 in 1,000 births. We see cleft lip and palate or one or the other. So it is common, but the other statistic that is a little bit alarming at times is in our First Nations population.
Right.
It is 1 in 750 births that are that take place. So it's there. There's really not much that can be done except we have to take the precautions.
We have a picture. Let's put up our first picture here just to give people an idea of what we're talking about. So explain this here, Dr. Rishiraj.
So on the left, what we have here is a baby that's born and has what we call a unilateral cleft. That means the cleft is on one side. The cleft can involve just the lip, the palate, or both. So on the right-hand side, you can see that it involves all the way across the palate. And these young newborns that when they're born, you know, are basically tagged with a stigma, like there is something wrong. And obviously there is, but it's a congenital defect. And I think the biggest thing that we need to realize is they're not missing a body part. What happened early in embryogenesis, at about 4 to 6 weeks, is the upper jaw did not fuse together. That's all it is. That's all that occurred. And all of a sudden they have this very massive visible defect that affects them cosmetically, but more importantly, it does affect them functionally.
Right.
So
we're going to follow along with some slides here, Dr. Rishiraj. So you've already addressed this, just talking a little bit about how prevalent it is, and of course more so in First Nations, in the First Nations culture. Risk factors, though, there are a few.
The risk factors that we can sort of identify and think can probably lead to problems are women who smoke during pregnancy have a higher risk, diabetes, obese women have a risk, older mothers, so you know, if the age is greater than 35, 30, 40, I mean there's no set number, but the risk just goes up. Some of the medications, particularly the seizure medications, can cause it. There's also a correlation between one parent and both parents having it. There's obviously a higher risk if both parents have cleft lip and palate. The child has a 50% chance versus 25% chance. So it is something that we're aware of in our society even. You know, you go to a developed world, these kids are basically shunned from the beginning.
Because they look different.
They look different, yeah. And it's a real problem. And actually about 9-10 years ago, I was going to start up a missionary work up in India. And I just ran into some politics there, and I haven't had a chance to go and do it. But it's something that I think we, in our developed world, see some. It's isolated, it's caught very early, where children who have a cleft lip or palate are basically taken care of by not the ministry but the medical system. And we have a very good plan at the Children's Hospital in Vancouver where these children are treated. And if we put up our next slide.
Yeah, the complications that can come along with this, you were talking about that.
Right, so some of the complications that come from having cleft lip or palate is obviously feeding. Feeding is a very big problem because they just don't have a seal.
And then that impacts your whole health,
Yeah. And speech becomes difficult. So it's very important that the surgical intervention get taken care of early so they develop normal speech. And you know, they have teeth that are missing, they're malaligned, they can develop a lot of ear infections. A lot of these kids, hearing loss can occur. Sometimes
I didn't know that. That really shocked me when I saw that
Yeah.
point right there. I didn't know that would be associated with
Yeah,
that.
because some of these kids not only have cleft lip and palate, but they also have syndromes associated with this. Thus, you're missing an ear, or you have a very small ear. You're missing the inner ear where you can't hear, right?
Yeah.
So hearing can be problematic, but majority of times they just have this isolated cleft lip and palate, which is, like I said, a very big cosmetic problem, not for the family, but for the kids as well.
What would be the treatment then, Dr. Rishiraj? There's several things I guess you could do, and it probably depends, I would assume, on the case itself.
Right. So the cleft lip and palate team most teams follow what we call a rule of tens. So initially you want to do the lip closure, and that's typically done around 10 months.
Okay.
You wait for the muscles and the palate to develop some more, which allows the surgeon to put the structures back together. You also want to make sure that the child has enough hemoglobin, because that's required for healing. They need to be about 10 pounds of weight. Then the second surgery is typically the palate repair, which is done at about 10 months.
Okay.
And then the next surgery that gets done is about 5 to 8 years of age. And that's when bone grafting is done to the upper jaw to allow for fusion of the area and to close the last little bit of mucosa that doesn't close over. And then finally, they will usually have another surgery to do the jaw surgery, which we talked about in an earlier segment.
And do you do this a lot? I thought, would this be something you would go to the hospital to do? I know you work out of your office, but also in the hospital.
So this is all done in the hospital.
Okay.
The primary surgeries are typically done at Children's Hospital.
Right.
Because they have a dedicated team.
Yes.
And then I get involved usually for the secondary repairs and the orthognathics. So yeah, it is, probably get about 5 to 10 a year, maybe.
Okay,
Some
so
years a little less.
Still happening.
Yeah. So, and it's like I said, it happens very early. So in the first 4 to 6 weeks of fetal development is when this fusion doesn't occur.
Wow.
And then, it's just a matter of developing, and everything develops. It's not that they're missing body parts. No, they have all the parts there. It's just a final fusion doesn't occur.
Thanks, Dr. Rishiraj. Very interesting. Some things I didn't know about that. So thank you so much. We really appreciate that. For more information, you can contact Dr. Rishiraj by any of those avenues there on the screen, website and phone number. We're back in a moment. Stay with us.